Michael, it's Susie. As everyone was talking, I started to make lists of all the organizations that have probably membership of everyone that could make a difference. You know, the architects, the engineers, the School of Medicine, actually the University of Hawaii's, all the departments, which I view as a mini society. And that was the basis for the Sustainable Saunders project that I had instituted at the University of Hawaii when I was legislator in residence. And then with Howard Wigg's conversation and some others, we started the renewable portfolio effort back in 1999 to have Hawaii become energy self-sufficient. But in all our design of existing and new buildings and outdoor spaces, etc., I think if we understood the goals of having or utilizing our natural resources the best we can, like right now, I don't know if you can see my hair blowing, but I'm at home working. We have built, a lot of windows so that there is that kind of very fresh air that comes in and out. I try to avoid air conditioning. And with Sustainable Saunders, we were able to prove with the Saunders Hall, we saved $700,000, I think, in 8 months by reducing the energy use because AC was so low, the temperature was so low, people were using space savers and of course the blankets that Phyllis mentioned. But when we started to modify that kind of environment, we actually saved money and made worker productivity better. And I know we haven't really mentioned about clients. I currently head up the Lanakila Senior Center, which is the largest senior center in Hawaii. Our center is closed. We normally would have maybe 600 people within a week or a month going through the center, plus maybe 200 guests. We are not able to do that, yet the facility itself was built by the state of Hawaii, utilizing the natural ventilation. Most of our space is open air, beautifully done, even though it was built 50 years ago. So I think we need to look at those things and involving all the different groups, of managers. There's associations where all the building managers are together. There's, of course, the groups that whose membership are the architects, the engineers, the plumbers, the pipe fitters, SHRM, which is the human resource group. To me, if we had all of those kinds of entities represented and there was that very intentional planning and designing and reconfiguring, renovating things, I think we could achieve many things that we're all hoping to do, not only for the COVID or the reduction or having safer and healthier buildings, but just overall reducing energy use, designing things that people can use in multiple ways, not single purpose ways, better utilize our space in every way, whether it's indoor or outdoor. So I know Howard mentioned that you're pulling groups together to educate. I just wanted to compare your list with what I have and make sure all these guys are on there. And if there is a way for the private sector, like what Chris and Phyllis and Manfred presented, I wish there was a broader group of private sector folks that have done this kind of research. And I don't know, Howard, if that's the format that you're thinking of, but where it's concisely presented that these are the best practices potentially for different goals, including the COVID pandemic. But then having everyone that can influence huge numbers of people at one time be educated at the meeting, and then they educate their membership. And if we do need to have participation in the thousands, I know, like AARP, Hawaii, and others who have that capability to bring on 30,000 people at one time. Or I just heard that the Kiwanis or something, they just did a national conference of tens of thousands of people at one time. We have the technology to educate people in a relatively short time if we can be very thoughtful of what presentations would help people the most to create their home space, their workspace, their play space. Maybe it's one space and everything is done in that space, you know, but I think we need to be very intentional about that. We have the capability.
Susie, I think you're right on a great point. In fact, as I mentioned early before we started the program, I started off in architecture and went to design. I'm a firm believer in designing up front, and design is not fashion. Design does not change with the whims of what looks good or what feels good, but what is good and what's going to be timeless and effective. And what I've noticed, though, working with Congress and working with legislators, is that we have lobbyists who have certain agendas who, even in spite of the fact that you have people with the greatest design intentions and a great deal of collaboration, all the second and third order effects go out the window, and all the unintended consequences go out the window when a special interest goes to the legislature and says, I want my technology in because it's more efficient, and we need to seal up buildings, or we need to do this, and it becomes law or policy. And so the way things that I see get shortcutted or get upset so many times is some of the best design and best intentions, like having people that appreciate what Phyllis and Manfred may have as inputs, gets pushed to the side because an industry has a lobbyist who goes to a legislator with money for their campaign and says, by the way, this is what would solve all your energy efficiency problems. You got to do this. And it takes care of their industry, but it's loaded with unintended consequences down the road. The example I give is compact fluorescent light bulbs. You know, we subsidized compact fluorescent light bulbs. We had everybody buying them and using them. Well, they all have mercury in them, and there was no way of controlling how you dispose of them. So everybody's throwing them in the trash. It ends up in the landfill, and it ends up in our water. So the unintended consequences of great energy saving was face to face with another environmental thing we shouldn't have done. And that was all facilitated by legislators who listened to special interest groups. So I think that
part of it, Stan, and I did hear your conversation before the start. I love that you had the operational maintenance background, etc. All the partners and users and people that will be maintaining the buildings need to be in conversation. And that's part of the reason why I wanted to get into, well, out of the legislature and really help the community organize themselves. If we have a robust way of developing, you know, informed kinds of policies, that helps the legislature, that helps city council. But to me, there is not a really well-organized way of gathering all of this expertise in a very consistent manner that can then help with the formation of policy. I did that in the area of Kupuna, and I did that in the area of children. It was through the Kupuna Caucus and the children Keiki Caucus. So in that way, we were able to do it. But in this other way, where there's environmental planning, energy, self-sufficiency, foods, self-sufficiency, etc., there has to be, I think, the larger community being able to have the conversation and to inform their policymakers.
I agree with,
okay. Oh,
I
sorry.
agree with you, and I think what's important is that organization you're talking about needs to be more powerful than the lobbying pressure that can be put on a politician. So I agree. What we probably need to do, if anything, is kind of limit the influence that special interests have versus the community interests that you're trying to organize and perpetuate.
Well, Stan, part of it is people are taking the initiative to inform. They may not have as broad an understanding of other options out there. So I don't necessarily blame those that are trying. I think most people are intending to do good. They may not have enough information that maybe there are other ways. And that's why the facilitation in the private sector has to occur. I don't think it's something government necessarily needs to do, although I'm sure DBED is a wonderful place to host that kind of conversation. But among the private sector guys, you have to think of all the groups that already exist and how we're going to pull them together so that if there is, you know, a plan, 1 year, 3 year, 5 year, 10 year, whatever the plans are that will make us much more energy self-sufficient, more food sustainable, more healthy overall in the physical environment as well as the social, emotional environment. I think it's not just for government or legislators to do. We have to take that initiative in the community.
Susie, this is Howard, and the Energy Office plus Hawaii Energy, together we make very, very good combo. We are completely equipped to put on webinars, and I'm looking forward to getting your lists so we can invite those lists to the webinars.
Yeah.
And already planning a webinar on stationary UVC lighting, especially for high occupancy areas, to make our spaces a lot safer. But you bring up a much larger issue, and I chair the Hawaii Building Code Council also. And it's free to sit in on those meetings. And I know all about lobbyists and that council, but what we get through is jealousy windows there's no restrictions on them whatsoever. More jealousies, the better. And then also ceiling fans. Ceiling fans are now mandatory in new residences because they're a great way to keep cool naturally. And from a COVID standpoint, they scatter the COVID around and reduce the dosage. Thank you.
Is it okay if I add one thing just to build on what you've said, Susie and Howard? And it goes back to your question, Michael, and that was, are there metrics out there? Is there a way to kind of get a handle on it? To me, data really helps get past people's view of self-interest and to realize that we're all in it together. Really, we really are. And of all the times we've ever said that, this is like the most true from my lifetime anyway. And so what we've been partnering with a mainland group and also a Canadian representative on that group to create a comprehensive assessment of building risk, planning and protecting policies and preparation and sanitation and who does what when people come back. And then the best practices for the protocol. If someone is infected, what do you do? How do you close up? How do you protect? How do you communicate? And then also this human component of how do you help people feel safe while they're driving to work or, you know, when they're leaving? How do you help them feel like everyone's going to play by the same norms and rules that you've set up so well for them? So I'm not saying that we're sure it would be helpful, but if what we're looking for is, and it's an online assessment, but it could be also done through a phone or Zoom where there's an interview and then we could fill it out for the person with them in case they don't know all the answers themselves or they're going to have to hand it off or we've been confusing in any way. So that's available. It's also in beta. But our commitment to that was you have to not only know your plan, but you have to reduce the risk of the building and you have to begin compliance before you can be in performance in all these 4 quadrants. And then the idea of each business going out and doing that on their own is kind of where we targeted it. But maybe there's a use of that at the school system level or at this community level, like the going to assess the housing problems in certain parts of our community. You know, I don't know, but I'm just saying we're willing. Okay, so if there's a way that we can be useful, if any of you want to see that, check it out. We'd be happy to share it. It's called a safe space assessment. And yeah, so, and it's not just us from Hawaii, it's like from Silicon Valley and, you know, people, we're checking out all of the nationwide norms and best practices as we create that. So the answer is yes, there are metrics. There are a lot of them. What we found was that all those checklists that were coming out, like, were overwhelming people. So we found a way to cull it down to the things that really matter and put it online for those that are it's convenient for to do it online. So if you're interested in that, just write to Manfred or me, and or just call us up. We'd be happy to talk to you about it. Again, that's a beta, so there's no cost to that either right now. And to me, why not? Why not try something that someone's put like 6 months of work into, to see if it could be useful or could be amended to help? Because we love it here. It's our home.
Phyllis, I think part of your clientele, it's individual businesses. We have to go beyond that because, for example, the Hawaii Condominium and Cooperatives Association, you know, that's almost every management company in Hawaii. And that's who I'm going to share this list with you, Howard. But there's large groups that can impact almost immediately. When you deal with individual businesses, it's too short. I mean, it's too long a process. And
you're right.
True what they're saying. They don't have control over that. Even if they ask, because it's done in a piecemeal manner, it's not very helpful even to the management companies. Or if we were to look at who are the landowners, you know, of all the commercial space, there's only about 10 landowners that own most of everything in Hawaii. Why can't we work with that group? In terms of the Hawaii Hotel Association, you know, they have, or I don't know if it's now the Hawaii Hotel and Lodging Association or they still exist as separate, both or one, but they could influence all of the hotels. Hawaii Public Housing Authority, which deals with tens of thousands of lives. I mean, they are having a problem with COVID as an example, but they also are one entity that can make significant changes in changing particular policies or ways that their employees are interacting or residents and requiring masks, whatever it is. There's larger groups that if given this kind of information, and you know, Howard, bless your heart, I know that the jealousies is something you're advocating from the community standpoint. That's also the easiest to break into. So we have to look at all the different aspects of what we're proposing and also understand what else is happening where people are starting to do other things besides jealousies. Because all our seniors, they have jealousies, but they get broken into a whole lot more than, say, my house that has those burglar-proof kinds of windows. So we have to look industry-wise even.
That's a great point.
How to address multiple concerns at one time.
Thank you, Susie. You're right. Yeah, so the idea of, we have presented to associations that represent employers, but we have a long way to go. And so anything that between you and Howard, whatever you think, if you feel that we can be useful, let us know. Otherwise, we'll have to go farther and scratch our heads going, okay, so how do we reach HHA? You know, that's something we'd need a handhold to do. You know what I mean?
Well, I think the state can take that leadership. To me, if DBED, and I can help Howard in connecting if you don't already have those, the heads, the CEOs, the presidents, the whatever. I mean, we just need to invite them. And I think the state has that ability to do that.
Okay, thanks, Susie. Thank you so much. I mean, we just have to solve this thing. When we started, like, Hawaii was the model in the nation, weren't we? Boy, I never thought it would switch like this myself. Manfred and I, we're like, we saw people not wearing masks, and we knew that there was overcrowding in the prison. We knew we had these societal problems, but everyone is already overwhelmed individually, and what can you do, right? And now here, look where we are. So we have to work together to solve it. We do.
There are ways, and I think the health professionals need to be integrated into this conversation a whole lot more, because I attend a lot of those kinds of consortiums and so forth, but I don't think they're involved at all in the environmental construction. You know, there's
Right.
not crossover. I am a part of almost every part of it, so I can see where there's so many missed opportunities. Yeah.
Yeah. You're muted, Michael.
Susie, let's talk again offline about this, but I'd like to end this now and thank everyone for participating. And we'll have to do our best to deal with this. And you know, leadership usually starts from a small group of people and just goes forward. So thank you very much for your leadership, and thank you, Stan. And I'd like to thank my son, Max, for helping organize this thing, and to Cindy and Willis for also helping. So thank you all. Until the next time.
Thank you, Michael.
Renew, rebuild Hawaii. Bye.
Thanks, Michael. And thanks, Max.